guys, and welcome back to my channel. My face looks red like someone that is blushing. Anyway, in this video I'm going to do a complete review of blood pressure, what it is, signs and symptoms, types, whatever, everything about it. But you will only know if you start to the end of this video, so please watch this video to the end. It's actually interesting. Back to my channel. For the new ones here, I am Brilliance, aka Brilliant Health. I make videos on health topics like this one here, so do well to subscribe to my channel so that you won't miss any other of my videos in my channel. And then so what is blood pressure? Actually, blood pressure is the force exerted by the circulating blood in your blood vessels. The blood vessels are mostly arteries that carry blood away from your heart to other parts of your body. Blood pressure is usually written in two numbers. Maybe I've seen it 120/80, 140/90, different. That's how it's usually written. So when the measurement is written down, you see one number first before the other, or one number on top of the other. The first number is known as the systolic blood pressure. That is the blood pressure, or that is the number gotten when the heart is beating. While the second number that is found second or under or below is the diastolic blood pressure. This pressure is gotten when the heart stops beating. So that's what it is. You have the systolic over the diastolic when the heart is beating, and the next is when the heart is at rest. But one thing about blood pressure is that blood pressure doesn't come with any sign or symptoms. Like, you know, there are some people that if you have headache or fever, you're like, I think I'll come down with malaria, like down here in Nigeria. But blood pressure doesn't come with any of that. In fact, the moment you start having chest pains, weakness, dizziness, my dear, it's really, really dangerous. You need to see your doctor right now. I mean, right now, the moment you're feeling it. That's why it's very important for you to book an appointment with your doctor or any other health personnel to get your blood pressure checked. You know, you're advised that you check your blood pressure at least once every year. But the moment you're diagnosed with blood pressure by your doctor or high blood pressure by your doctor, you need to check it more often. I would suggest maybe every 2 months, but more often is not the crime. Actually, when you're measuring your blood pressure, manually the sphygmomanometer, or the sphig for short, and the stethoscope is what is usually used. The sphygmomanometer is made up of the bladder, the cuff, the bulb, and the gauge. Yes, the bladder is inside the cuff that is tied around your upper arm. Here, note that blood pressure that is taken around here, maybe in the digital world, is hardly reliable. If you really want a standard one, get it at this point. This is going to get you the standard one. So when you inflate, when you pump your bulb, it's going to inflate the bladder in the cuff tied here in your arm, and it's going to stop the blood flow. When you release the pressure from the bladder that's tied above your elbow, is going to continue the blood flow. It's at this point you will listen carefully, because the first sound you hear or you hear is going to be the systolic blood pressure. You mark that point. Now you keep on listening. The time that sound disappears is going to be your diastolic blood pressure. You can try it like 1, 2, 3 times with 1 minute interval for you to get your average blood pressure. So now I'm going to give you what is low blood pressure, or the ranges as low blood pressure, normal blood pressure, and high blood pressure. Low blood pressure is known as hypotension, normal blood pressure is known as normal blood pressure, while high blood pressure is known as hypertension. So the low blood pressure, we have 3 categories in the low blood pressure. You have 90/60, which is called the borderline low blood pressure. You have 60/40, which is called the too low blood pressure. 2 as in TOO, as in too low blood pressure. Then for 50/33, you have the dangerously low blood pressure. So for the low, you have 90/60 as optimal, borderline. Anything more than that is too low, that is 60/40, or dangerously low, that is 50/33. For the normal blood pressure, we have 3 categories in these two. For the high normal blood pressure, we have 130/85. For the normal blood pressure, we have 120/80, and then for the low normal blood pressure, we have 110/75. So we have 130/85 as the high normal. For normal, we have 120/80, and for the low normal, we have 110/75. Now, for the hypertension, we have 4 stages in this because it's really dangerous. We have 4 stages, and I'm going to take it from order of seriousness to less serious, though they are all serious, but the most serious to the less serious. So for the stage 4 hypertension, we have 210/120. For stage 3 hypertension, we have 180/110. For stage 2 hypertension, we have 160/100, and for the stage 1 hypertension, we have 140/90. Now, from the less serious to the most serious, I will rearrange it. We have 140/90, we have 160/100, we have 180/110, and then we have 210/180. This is serious. You really need to meet your doctors. Now, for any of these, your doctor is going to encourage you to do lifestyle changes, dietary changes, and take medications for it. I have some videos on some of the lifestyle changes and the dietary changes. I will leave the link down at the end of this video. Please do well to click it and watch it. It's really going to help you. Now I'm going to go into I'm just going to give a range of blood pressure for male and female for different ages, maybe from 90 to 60, and see that though we say the normal range of 120/80 is normal for adults, decreasing age, as you increase in age, is going to increase your blood pressure also. So you will know which point you don't need to bother. I know you might have had maybe a reading of 120/100. You have your systolic blood pressure as normal, but your diastolic is abnormal. Don't be deceived, you have high blood pressure. You might have also had 140/80. Your diastolic is normal, but your systolic is abnormal. You have high blood pressure. Or you have 140/100. Both of them is high. You have high blood pressure. So what I'm trying to say is that whether your systolic alone is high, or your diastolic alone is high, or you have both of them high, my dear, you have high blood pressure. But we don't know the cause of high blood pressure. All we can say is that we know some contributing factors like age, stress, sleep apnea, smoking, genetics, family history, too much weight, too much salt intake, lack of exercise, chronic kidney disease, high or average alcohol consumption, and then thyroid or adrenal disorders. These are some contributing factors. But there are also signs and symptoms of high blood pressure. Example, you have headache, you have dizziness, you have pounding in your ears, and then you have bloody nose. These signs and symptoms do not occur except your stage has reached a very life-threatening stage. So I suggest check your blood pressure always. Do not let it reach that stage. Watch this video, share this video to other of your friends and people that you love so that they will know and then save themselves from reaching that dangerous stage. Now, some of the risk factors for blood pressure include you have diabetes, yes, you consume more than 2 drinks of alcohol a day, and then you have food high in saturated fats. This can become a risk factor for blood pressure. So you might be taking medications, you might be doing lifestyle changes, you might have been exercising, dietary changes, you might have done all of them, but you check and maybe sometimes you have a spike in your blood pressure. Just know that the medications do not cure hypertension. Hypertension is not curable, it only controls your high blood pressure. So there is no medicine, none at all, that can cure your high blood pressure. You can only control it very well, that you will not even have a rise. But the moment you stop or relapse, my dear, your blood pressure is going to spike. So keep on the good work. I know you've tried exercises, food, different. In fact, some people see their food as tasteless. I've actually had that, but you need to continue. It's for your health. I'm going to give like a blood pressure range according to age from 19 to 60. Yes, from 19 to 60. I'm going to give the range for male and female. Okay. From 19 to 24, we have 120/79 and we have 120/79, meaning both of them is for both male and female. For 25 to 29, we have 120/80 for females and 121/80 for males. For 30 to 35, we have 122/81 for females. We have 123/82 for males. For 36 to 39, we have 123 over 82 for females, and we have 124 over 83 for males. For age 40 to 45, we have 124 over 83 for females, and we have 125 over 83 for males. For 50 to 55, we have 129 over 85 for females, and we have 127 over 84 for males. 85, sorry, we have 128 over 85 for males. For 56 to 59, we have 130 over 86 for females, and we have 131 over 87 for males. And for 60 and above, we have 134 over 84 for females, and we have 135 over 88 for males. I can't get this into my head because I'm going to mix it up, and I don't want to mix something very important like this. So like I said, for average adults, we say the 120/80 is the normal blood pressure, but from 50 and 60 plus, do not be scared when you have a blood pressure of 130 to 135, because like I said, the risk factor or the contributing factor for high blood pressure is age. So as you age, your blood pressure is going to increase, so don't get that up. But the moment it leaves 130 and reach 140 plus, you need to take that into consideration, because it's going to really do a very dangerous effect, especially for your Asian height. It won't be good. So do well to share this video so that most of your friends too will come to know about it. And like I said, the link of this video is down on the screen now, of other videos on my health topics. So do well to click them and watch and know more about your blood pressure. Thank you for watching my video up to this time. I so love you guys. Please do well to subscribe and like. Thank you.